let's maybe start off by sort of generally discussing the design of EV-103, and in particular, maybe with some focus on Cohort A, whose results you presented, and what question the cohort was trying to investigate. And then maybe after that, we'll get into the results.
Sounds good. So the EV-103, as you know, is an open label, multiple cohort phase 1b/2 study, which has several cohorts. And the patient population for the cohort A was locally advanced or metastatic urothelial cancer patients who were ineligible to receive cisplatin. And there was a dose escalation portion with 5 patients, and then the dose expansion cohort A consisted of 40 patients. And in addition to this, there was a cohort K in this study, which was a randomized study between EV and Pembro versus EV monotherapy, also in cisplatin ineligible treatment naive patients, and that was around a 150 patient cohort. And there are several other cohorts in this EV-103 study for the neoadjuvant setting, etc. But for the purposes of EV Pembro in metastatic disease, these are the 2 cohorts that led to the accelerated FDA approval.
Great. Yeah. Thank you for that summary. Yeah, it certainly has been a pretty pivotal and important trial. And so at this past ASCO conference, you presented the updated results of Cohort A, which of course was originally presented a few years back. But can you maybe walk us through, the main highlights of the things that you talked about?
Yes, so the EV-103 cohort A initially had demonstrated that the combination has rapid and durable responses, around 68% confirmed objective response rates, and a manageable safety profile when we put it together with the expanded cohort K as well. And at ASCO 2023, we presented the median follow-up of 47-month data, so almost 4-year follow-up of the cohort A, which initially showed the remarkable activity of this combination.
Yeah, and what was the duration of response, or sort of approximately the findings there?
Yes, so in this we saw that the patients were treated for a median duration of 7 months, receiving approximately 9 treatment cycles, and the duration of response was 22.1 months at this longer follow-up. And that is really something very important for this patient population, as you know. And we saw that at 24 months, 41% patients were still progression-free, and the median progression-free survival was 12.7 months, and the tail of the curve was holding very nicely and steadily. Also, the overall survival exceeded 2 years. It was 26.1 months. And again, this was all at a median follow-up of 47 months. So all the results that we saw initially were holding up really nicely. And the objective response rates overall was 73.3%.
Yeah, and this is pretty remarkable data after really long follow-up, 4 years, as you mentioned. Maybe you can comment a little bit of how do these outcomes and results really compare to what we would consider a standard of care in this setting, maybe before this trial, since this was a single-arm study.
Right. So before this, the level 1 evidence is for this patient population who cannot get cisplatin, the data from the Javelin Bladder 100 trial, where gemcitabine and carboplatin 4 to 6 cycles followed by maintenance avelumab led to an improvement in overall survival, significant improvement, and has been the standard since 2020. And updated results from the Javelin Bladder 100 trial also show that the median overall survival with platinum followed by avelumab is close to around 2 years or so, right? So I think that has been our standard. And this is clearly very interesting and promising data. But like you said, it is based on the phase 1. The good news is that it is holding steadily at 4 years. I think the big question on everybody's mind is, will this beat the current standard? And the EV-302 trial, which is the phase 3 trial, which is comparing patients in the frontline setting, whether they are cis eligible or cis ineligible, with EV and Pembro. So the control arm gets platinums, and then they're compared against EV Pembro that has completed accrual. We'll see the results. But I do want to mention that the control arm of that study is not the current standard, right? Avelumab maintenance is not a part of the protocol-directed therapy, but patients who met the criteria after it was approved were allowed to get it. So I think when we really see the results of that study, we will not have a very clear picture, because it's possible that most patients did not get avelumab maintenance. So we just have to keep that in mind. But as of now, I would say that this is certainly an exciting option for patients, and something else to consider for patients, who otherwise we would offer gemcarbo.
Yeah. So a couple of very, I think, interesting points you just made. One is, of course, the comparison to the Javelin Bladder 100 population, and specifically those patients treated with carboplatin followed by avelumab maintenance rather than cisplatin. Of course, in that study, you really and the outcomes really reflect patients who do well, right? To those who actually have had a response or at least stable disease with carboplatin, right? And that's who went on to avelumab, and then the median survival was close to 2 years. Of course, unfortunately, not all patients, right, that start platinum-based therapy, specifically carboplatin-based therapy, make it to that point. Unfortunately, some don't have responses or stable disease and have primary progression. And your study, so in the study you presented, so EV-103, that was for all comers, and we see the median again survival of I believe it was like around 26 months, right? Which compared actually pretty favorably to, again, these historical controls.